costly physical disorders. Please welcome Dr. Dwaine.
All right, I'm very pleased to be here, you all. I'm very passionate about the information I'm about to present to you today. Before we get started, I want to just do a little experiment. Everyone raise your right hand. Just everybody raise your right hand for me, just real quick. Raise your right hand. Everybody get them. Okay, good. That's fine. I just want to make sure your arm works. Now, second thing is, if you want to take little to no drugs in the future, please raise your hand. Okay? If you want to avoid surgeries in the future, please raise your hand. All right? Good. And if you want to be as healthy as possible, enjoy life as much as possible, and be as productive and avoid being sick, please raise your hand. Good. And we're on the same page. Perfect. So the name of today's presentation is staying fit while you sit. As it turns out that we are sitting a bunch. Between the computer, driving in your car, watching TV, eating, all these things together. In fact, you've got an article that we passed out that's called Sitting is Killing Us, and there's some commentary from Mayo Clinic, but they say as much as 15 hours a day that we're actually sitting. So we want to make the best of it and maybe even limit the amount of sitting that we're doing so you enjoy a good quality of life as possible. So we talk about ergonomics. Ergonomics relates to the science of adapting your environment so that as to decrease the stress to your body and reduce discomfort. So everything from the pen that you use to your work setting and so forth all pertain to your work environment. Poor ergonomics and sitting too much and doing it the wrong way can and does affect your back, your legs, your hands, your arms, and your neck. By the way, the second most common reason people go to a doctor, other than the common cold, some of these things a few minutes, but as far as even keyboarding, this is what's amazing. How much pressure or exertion do you suppose it takes if you type 60 words a minute for 6 hours a day? Any guesses? How much weight do you think you're lifting over the course of a day?
Over the course of a day?
Yeah.
15 pounds,
15 pounds, 20 pounds?
100 pounds.
100 pounds maybe? 27 tons.
Holy cow!
Yeah, you're doing a lot. For your eyes' sake, you want to be able to look away from the screen every so often. Look outside. If you got a window, you want to look out a window every few minutes. And we have these little ciliary muscles that control the focusing of your eyes. And so if you look far away, then you're contracting those muscles to adjust your vision. And you look back at your computer, you look far away, you look back at your computer. A little technique we teach our patients in the practice is to, if your eyes are weak, to get one of these little mini trampolines, and if you spend some time on the mini trampoline, you can put a dot on the wall, we'll say, and then if you're on the mini trampoline, you're just focusing your vision on that dot, and because your body is moving in relation to that, those muscles are getting lots of exercise, they're contracting and relaxing. Even though it's a slight amount, it's repetitive, and so it's a very good way of strengthening your vision. Most of